Today we are here to talk about the role physical therapists can play in providing safer ways to manage pain and prevent opioid dependency. The PT's role in opioid use dependency prevention. Opioid use disorder is a substance abuse disorder resulting from overuse and addiction of opioids with extreme consequences that eventually can lead to death. It's a complex issue to maintain the balance between pain management and opioid misuse. 75% of all opioid addictions begin with a prescription. This is where the PTs can come in. The PT's role should center around advocacy and education to prevent the initial prescription of opioids by getting involved earlier in the continuum of care. The key role for physical therapists in the prevention of OUD is to become more involved earlier in the continuum of care, as we mentioned, through advocacy for their profession and education in their community. This may be easier for physical therapists in states with direct access. However, no matter where one practices, there's always ways to get involved earlier. Advocating for your profession is a huge way that can play a vital role in OUD prevention. Doctors need to refer patients to us before prescribing opioids. Insurance companies need to reimburse for pain relief techniques done by PTs before seeing a doctor. And they can make physical therapy more affordable by lowering copays. Lawmakers in states that don't allow direct access to PTs need to understand the role we can play in this fight if given the chance. As far as the insurance companies eliminating copays to make treatments more affordable and an updated reimbursement model that will pay for early, non-pharmacological treatment such as physical therapy, that will go a long way in that initial prevention of the prescription of opioids, thus lowering the patient's chances for OUD. Education in the community should revolve around schools, churches, and health fairs. Just getting out in your community and having a voice for what PTs can do and the harmfulness of opioids will lead a lot of patients to try you before ever seeking out an initial prescription. As physical therapists, it's important to back up what you just preached to your community and fellow healthcare professionals. Once you get these patients, you need to screen them for further OUD risk, identify patients whose injuries and pain levels are going to put them at increased risk to seek pharmacological options. Use evidence-based practice to treat chronic pain. Do your research and do continuing education to stay relevant on the best pain management techniques in our profession. Then it's important to use a multidisciplinary healthcare team. Communicate between professionals to optimize patient care and use the entire healthcare team. Finally, it's important that we continue to educate these patients on reducing modifiable risk factors and performing their home exercise as planned to keep them out of pain.
Mitigation strategies to proactively reduce the risk of OUD as physical therapists can include screening tools. The DSM has focused on 9 aberrant behaviors listed in the table provided to help identify at-risk patients. Doctor shopping, frequent lost prescriptions, and repeated requests for early prescriptions are a few examples of these behaviors. You can use this table from the DSM-5 to create a screening tool that best fits your practice and the patients in your practice. Some of the major OUD characteristics that are listed are undertreated chronic pain, non-medically supervised recreational use for relief, and use for relief from psychological and emotional stress. With growing healthcare costs and mounting disability, there is an increased demand for physical therapists to promote more effective self-management strategies for patients with chronic pain. It is important for us as therapists to use evidence-based practice. One good example of this is PNE, which is Pain Neuroscience Education. It is a method of educating patients about neurophysiology of pain that aims to reconceptualize the pain from an indicator of damage to an interpretation of input signals by the brain and the nervous system. The analogy used often is normally having a highly sensitive alarm system when you have chronic pain. It would be our goal to decrease the sensitivity of that alarm system. Another example is pain self-efficacy. This is defined as a patient's confidence in his or her ability to tolerate pain and perform daily activities despite pain. So it would be our goal to reintroduce the patient to daily activities that have become painful. Strategies to promote patient engagement and self-management behaviors and their theoretical underpinnings are not familiar to many physical therapists and may require additional training.
A multidisciplinary approach should always be used when treating a patient, especially when opioids are involved. Early recognition is crucial in preventing dependency. A PT should be involved early in the treatment process when chronic pain is diagnosed, but also be aware of the subtle signs of opioid dependency. If a dependency is suspected, appropriate referral back to the physician should be made immediately, and from here the physician should make further referrals to other members of the team, whether that be a psychologist or a pharmacist. Behavioral therapy is proven to be effective in treating dependency, and a pharmacist can work with the dosage to hopefully begin the process of removing the patient from opioids altogether. The ultimate goal of patient care is to get the patient back to baseline as quickly and efficiently as possible, and this is achieved by including the entire team in the treatment process.
Patient education is key to premordial and primary care. You want your patients to take an active role in their health care. You want them to stay physically active to prevent the prevalence of other comorbidities such as obesity or diabetes, while also focusing on modifiable risk factors such as smoking and diet. They also need to know the importance of the home exercise plan, as this can be the difference between renewed life or chronic pain while dealing with injuries. Continue to remind them of the harmful aspects of opioid use disorder and keep them focused on achieving their physical therapy goals.